Hello class, today I'm going to talk to you about joints, and you should already have these pictures available in your files for week 3 in Adverum. So the first thing we're going to look at is how we can classify joints, and we can basically lump them into 3 different categories, which are the fibrous, cartilaginous, and synovial joints. So for fibrous, there are 3 subtypes. And fibrous already tells you they're made out of fibrous connective tissue. Right here, you can see it, dense, regular connective tissue. So first we've got the Gon Phasis. What I would do for that is just draw like a typical, it's supposed to be a tooth. I know it's not beautiful, sorry for that. But there's your typical tooth. And around it, this is actually your jawbone. So let's assume if it's in your lower jaw, this would be your mandible, and then this, of course, is the tooth. And what's happening is that there's little tiny fibrous ligaments that hold it into place. Okay, so that's the actual joint right there. And notice, right here, it says it's immobile. So your teeth should not be wiggling around. In fact, if you get an injury where your tooth is loose, that's a bad thing. Or if you've ever had a tooth pulled, you know how much that hurts. So these ligaments are supposed to be quite strong at keeping that tooth in place. Next, we have our sutures. So if you draw your typical skull right there. Yay, he's so happy, like a little skull right there. And we already learned some of the sutures in lab. You've got your sagittal, and then you've got your coronal, kind of like that. Sorry for my artistic ability. I'm using a tablet and it's not quite working out the way I wanted to, but that's okay. All right, next we've got our syndesmosis. So these are the weirdest ones. Also made out of connective tissue. 2 places you find them are going to be your forearm and then your lower leg. So if you draw a typical, and this is not going to be beautiful, but like a typical ulna, and then you've got your radius, like that. So there's a little gap between these 2 bones. This is supposed to be radius, and this is supposed to be ulna. And that little gap in between them, they're actually held together by this connective tissue. Okay, and that's your syndesmosis. And it allows some flexibility. So for example, when you rotate your forearm, the radius curves over the ulna, crosses over to allow that motion, but the 2 bones stay approximately the same distance apart the whole time. Next, we're going to move on to the synchondrosis. And the epiphyseal plates we've talked about previously. So if you have your diagram of the bone, we talked about how this one is actually made out of hyaline cartilage, right? So there's hyaline cartilage there, and it's found in the ends, the proximal epiphysis and distal the proximal epiphysis and the distal epiphysis of the long bone. So it's found, of course, in children, and it's another example of one that really should be immobile. There's no reason for those bones to be moving. So the top and the shaft of the bone are not going to be moving apart, but they're allowed to grow. Then we have some fibrocartilage in the pubic symphysis, as well as the intervertebral disc. So we talked about that in histology, that those are 2 locations where fibrous cartilage can be found. And these actually do have a slightly mobile ability. So for example, your vertebral column, each individual vertebra does not move that much compared to the other one, but when you have a whole bunch of them and all of them are moving a little bit, you're able to flex your spinal column. So they are slightly mobile. And then the pubic symphysis as well, especially for ladies who are pregnant and who are getting close to childbirth, their pubic symphysis will allow their 2 coccyx bones, their pelvic bones, to move slightly and allow the angle to widen. So for example, if it looks kind of like that, and there's this is supposed to be pelvis, then your pubic symphysis is right there in the middle. Okay. Next, we have our synovial joints, and there's quite a few of them. I'm not going to draw all of those, but these are your most mobile types of joints. So notice we have our plane joint. Those are going to be intercarpal joints. So that's, if you can recall, that's in your wrist. And then your intertarsal joints are going to be in your ankle. And this type of joint has many little bones that are basically sliding across from each other to allow motion. So you have motion in a couple different directions based on which bones you're flexing. Next, we have our hinge joint. This one people usually remember quite well because hinge joint, it basically opens and closes like a door with a hinge. So you've got your elbow joint and your knee joint that do that motion. Pivot joint is only found in a couple of places. The drawing they usually have for that is that you have sort of an axis thing and then you have something around it that is allowing this rotational motion. So the easiest one to remember, the atlantoaxial joint, if you recall, the atlas is the bone of the vertebra, the number one bone that is holding up your skull. Okay, so the atlas is actually C1 vertebra, and then the axis is the C2 vertebra, and it's the one that has that little thing sticking up like that called the dens. So the dens is the axis point, and then what happens is the atlas can rotate around the dens, and this allows you to turn your head left and right. Okay, so moving on to a condylar and saddle joint. These are going to be found in the hands. So the condylar joint is going to be a metacarpophalangeal, so that's a mouthful right there, but basically it's where your knuckles are. Okay, so think of where your knuckles are, and your your metacarpals and your phalanges are touching there. Then saddle joint is very unique. It's actually only found in the thumb, okay, and it's where the thumb touches the metacarpal bone. Okay, so it's one of the reasons why we have such dexterity in our hands compared to other animals. They don't have this kind of joint in their thumb. And then the last one here, ball and socket joint, that's going to be found in your hip. And then the glenohumeral joint is just your shoulder. So that also has a really nice, notice it says right here, freely mobile. It has almost a 360-degree rotational movement. The downside of that is it's also more prone to injury. So especially the ball and socket joint of the shoulder, it's kind of loosey-goosey. If any of you have ever dislocated a shoulder before, you might know that the ligaments there can be pulled too far, and then basically the humerus kind of pops out of that joint, has to be pushed back in, and it's very painful. So now let's continue on and look at a synovial joint in more detail. So here's our synovial joint. What makes this type of joint special is that it produces something called synovial fluid. Okay, so the other two types, the fibrous and the cartilaginous, do not have that. And there are some terms on this diagram that should be familiar to you. So the periosteum, we've seen that before. It's made out of a type of dense connective tissue that is wrapped around your bone. And so it has a protective layer, almost like a skin-like layer on the outside of the bone. We've also seen yellow bone marrow before. So yellow bone marrow takes up the inside of your long bone. It is yellow, which is it's basically adipose tissue in the adult, but there's also red bone marrow there when you're still a child. And that one, of course, is producing red blood cells. So then let's continue on with some other things on this diagram. So at the end of your long bones, you're going to have cartilage right here. So this bone will have cartilage and this bone will have cartilage, and it's referred to as articular cartilage because it's an articulation. So articulation means it's a joint, it's where two bones meet. And if you recall the type of cartilage, so you can think for a second, what type of cartilage do we find at the end of our long bones? You have hyaline cartilage here. Then on the outside of the joint, kind of holding everything together, you have what's called the articular capsule. And the articular capsule is actually, well, I'm going to erase that color because I'm going to color code the two layers. So there's a fibrous layer The fibrous layer is this outermost layer right here. And that fibrous layer is, of course, made out of fibrous, dense connective tissue. So dense, fibrous connective tissue, very strong, holds the joint together. The inner layer is the synovial membrane. So you can see the synovial membrane basically starts right where the articular cartilage ends, and it will wrap around the inner part of this articular capsule. It's on both sides. It's everywhere. It's everywhere where there's no hyaline cartilage. And what it will do is there's going to be special cells here that make the synovial fluid. And the synovial fluid is there for the same reason that we saw fluid elsewhere in the body. So when we talked about the pleural cavity and the pericardial cavity, we talked about how those membranes produce some fluid. And the fluid here has the same purpose, which is to reduce friction. But it is a slightly different composition. It's not the same kind of fluid as what you find in the pericardial sac or in the pleura. The joint cavity is just basically that space where the synovial fluid is. And then the last thing on this diagram is the ligament. So the ligament shown right here is not quite the same thing as that articular capsule. The point of the ligament is it's a type of dense connective tissue. Again, it's actually dense regular connective tissue, and it holds two bones together. So that's its purpose. Please don't confuse it with tendon. Okay, so it's not a tendon. Tendon's purpose is to hold muscle to bone. So if you ever do some kind of surgery on a joint, you're going to see a lot of different types of connective tissue. You'll see the tendons that were holding the muscles there. You'll see the ligaments that were holding the bone to the bone. You'll see this fibrous layer of the articular capsule. And then you'll also see some connective tissue in the synovial membrane. So let's see. The last thing that's not labeled, but it's good for you to kind of remember, let's use this color, is this part right here. So notice this is bone in this picture, which means this is an adult, but if this were still a child, then you would have the epiphyseal plate, which is made out of cartilage to allow these bones to grow. But since the cartilage has clearly been replaced by bone through the process of ossification, which we talked about last week, this is an adult joint.